Hi, I'm Angela Williams. I'm going to be doing a physical assessment. This is Miss Wade. She has no involuntary movements noted when she walked into the room. Patient sits comfortable and erect in chair with hands and arms to her side facing forward. Patient is clean, clothing is appropriate, and has no physical deformities. Hi, how are you today?
I'm good.
Can you tell me your name and date of birth?
Cynthia Wade, 10/5/91.
Okay. Are you having any pain right now?
No.
Can you tell me where you're at?
I'm in the hospital.
Okay. And do you know what month it is?
It's September.
Okay. And who is the president?
Barack Obama.
Okay. Patient speaks clearly and in full sentences, forms words appropriately, and understands. Patient can hear my questions and answers without repeating. Patient makes eye contact and is alert and oriented. Okay, I'm just going to look at your skin here, okay? So it's good. And this side. Okay, perfect. Patient's skin tone is even, pink, warm, and dry. No lesions noted. She does have random freckles and moles, no deformities of hands and nails, and they are intact and clean. Okay. I'm just going to look at your scalp here, okay? Okay. Have you noticed anything abnormal or? No? Okay. Perfect. Looks good. Okay. Patient has no irregularities of masses on scalp, no lesions. Hair is neat and clean. Face is symmetrical with no drooping. Okay. And then I'm just going to check your temporal arteries here. Okay. Perfect. Sorry, my hands are cold. It's okay. Okay. And then temporal artery is palpable, and then temporal mandibular joint has no difficulties, is smooth when opening and closing mouth, no pain when palpating sinuses noted. Let me just check this again, okay? Do you feel any pressure? No? Okay, perfect. I'm just going to check your eyes here. I'm going to shine a pen light, okay? Just look forward for me. You look at this pen light, and then I'm going to move it towards you, okay? Perfect. Okay, and then I'm just going to have you follow the pen light, okay? And look for, there we go. Pulse off table. Perfect. That is so cute.
Seriously?
Oh, did I walk right in front of it?
Yes.
Oh, golly, I'm sorry. Can you back it up?
You can back it up. Just keep going. I could try to cut it out.
Okay. I'm sorry.
It's okay. Just go. Just go.
Patient has appropriate peripheral vision bilaterally. Patient has no irregular during corneal light reflex test. Patient can follow my fingers and pen light appropriately when checking her gazes. Patient has no deviations during the test. Conjunctiva and sclera are all intact with no inflammation or redness noted. The corneas and irises are both intact and equal. Both pupils are reactive to light and equal. When testing a patient with the Snellen chart, which we did not do, you would want them to stand 20 feet away, cover an eye, and read the smallest line they can see and repeat with the other eye. Okay, I'm just going to look at your ears, okay? Have you had any ear pain?
No.
Both ears are equal with no drainage or irregularities. The ear canals are both intact with a small amount of earwax. Tympanic membranes are both shiny and translucent. Patient is able to hear appropriately in both ears. Okay. I'm going to go ahead and look in your nose, okay? Perfect. And go ahead and open your mouth for me. Perfect. Have you had any nasal drainage or anything like that?
No, not a lot.
Okay. And have you noticed any sores or anything in your mouth that?
No.
No? Okay. Patient nose is clean with no drainage. Both nostrils are intact with no lesions. Nostrils are also symmetrical and patent. Nostrils are dry, septum is intact, and turbinates do not have any growths or polyps. Buccal mucosa is moist, intact with no lesions. Teeth are white, clean, and intact. They are straight and show no signs of wear. Gums are pink, moist, and intact. No swelling, bleeding, or irregular margins are noted. The tongue is pink and with normal sized taste buds. The floor of the mouth has no lesions or white patches. It is pink, moist, and intact. There are no irregularities with soft or hard palate. They are both intact and moist. When patient is asked to the uvula and soft palate rise. It is not irregular in size, and it is fleshy. Patient has grade 1 tonsils that are pink and non-inflamed. Patient has no problems or deviations with sticking out tongue. During the inspection of the neck, we've done a second ago, it is symmetrical with no palpable masses. The carotid artery is palpable with no bounding pulse or jugular vein distension. Okay, I'm just going to check your lymph nodes here in your neck. Have you noticed any discomfort or pain or anything like that? Okay, let's kind of check along here. I'm going to palpate the thyroid just a little bit. Okay. Lymph nodes of neck, head are movable, discrete, soft, and non-tender. Trachea is midline. Thyroid gland is present. Patient able to perform range of motion with no limitations of movement during active motion whenever she turns her neck and moves her shoulders. The motion is smooth and controlled. Okay. I'm just going to listen to your heart now, okay? Listen to your breath sounds, okay? Have you noticed any coughing or extra drainage or anything like that?
No.
Okay. Go ahead and take a deep breath for me, in and out. Patient chest is symmetrical along with shoulders and muscles. Tactile formitis performed and is symmetrical. Vibrations are felt on each side. No masses or tenderness present during assessment. Patient breath sounds are clear, bilateral. And then I'm just going to do a quick assessment here on your lungs, and whenever I do, I want you to say E. Okay?
Every time, or?
I'm sorry?
Every time?
Yes, please.
E. 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 E.
Okay, perfect. Okay, and that all sounded clear. And apical rate was regular with normal heart tones with a pulse of 83. think that includes our assessment today. Thank you.